نقول بس سطرين كده او سلايدين عشان نوري فكره المحاضره انها مهمه جدا. اتفضل دكتور احمد.
صباح الخير، وسعيد ان انا اكون معاكم النهارده، وعارف ان احنا مستعجلين، فانا قدامي 8 دقايق، واتمنى هاني ما يفتكرش الدقيقتين اللي انا اتبرعت بيهم احتمال اجور عليهم يعني. اوكي. انا المحاضره النهارده عن التوب 10 AI applications that I have used and I believe are worthy of you trying them. I've used so many applications and I was fortunate to be in the clinical practice. أنا ما أعرفش، أنا بتهيألي الميكروفون أنا هستخدم ده أحسن يعني. I was really fortunate to be both in the clinical practice of radiology, working with my colleagues extensively, but also through my relationship with Meridian Healthcare, I had that very close relationship and ability to access new AI applications. And I thought, what if I were to recommend AI applications for my colleagues to get into the world of AI? What would make most sense and what would give the best return on their investment? And I'm not talking only money investment, I'm talking about investment in deployment and know-how and expertise and time allocated. So there's so much going investment-wise. So I have no disclosures that would conflict with the nature of this meeting. My agenda is pretty simple. I'll start with an AI definition that I'm sure all of you already know. I will move on to breast cancer screening, and this is not my agenda, by the way. This was from another presentation, but it will work. I will work on, I will show some AI applications, and I will overview deployment, and I will wrap up by reflecting on AI. Okay, so what is the definition of AI? AI basically refers to computers capable of emulating human intelligence. What are the hallmarks of human intelligence? Couple of things. Number one, the ability to solve problems, and the other is the ability to learn. And that ability to learn, being able to emulate the ability to learn, is what made us able to take such great strides in the world of AI. I do not need to remind you that every one of you is engaging with AI in their daily life, whether you're using face recognition to access your mobile, you're on social media, you're having voice recognition in your reporting, Google, whether it's Google Maps or Google Search, banking, Netflix, Amazon. These are all applications that would not be here today if it were not for AI. So you are working with AI. Now, let's get a little bit more clinical and get into our world of radiology. We know that imaging is challenged. Our numbers are not really going up to meet the demand. And what that spells is having errors and also having staff burnouts. And this is really serious. And we cannot increase the numbers overnight, but what we can do, we can reach out for tools such as AI that would help us bridge that gap. So we have about 1,000 AI applications in healthcare. Over 750 of those are in our world of radiology, but choosing which one to go for is really challenging. So I'll give you my top 10 over the next 5 or so minutes. Number one, the holy grail of radiology is radiation dose, and radiation dose reduction is something, we had a whole lecture on reduction of radiation dose. Problem is, you get a bit brave and decide that you're going to reduce the dose, you slash it by 50% as in this image, and you end up with a lousy image that's basically non-interpretable. What do you do about that? AI can help. AI can rebuild that image for you and bring it back to its original glory, 50% of the dose. So your patient gets less radiation dose, your machines get less utilized, and your staff are in a safer place. So everyone wins. Number two, The holy grail of MRI is time. You want your patient to spend as little a time within that bore, within that magnet. However, if you again have the courage to slash the time by 50%, you end up with images that are lacking in information. And this is where AI comes in and rebuilds that image for you and brings it back to what it would have been like should you have kept that patient for the whole time. So time reduction in MRI, 50% is quite achievable. More than that is actually being tried nowadays. So there's so much going on. What about a third challenge? We had a whole lecture on contrast media, and I think the source of all evil from contrast media is from the dose. And if you can reduce the dose and take an image like this, it's like wasting your time, your patient's time, and exposing him for nothing. However, what we've done with this patient is the dose was reduced by 90%. So only 10% of the dose was given to the patient, and using AI, the image or the contrast enhancement was boosted, and we're back to where we were, but only saving 90%. Your patient feels much better, you saved a lot of money. Number 4, if only we had an application that would do all these measurements for us. And it's not just the scoliosis and the flat feet measurements. We have over 150 orthopedic measurements to remember, if you can remember, if you have the time. But if you have a system that would actually lay out these measurements for you automatically and consistently, so every time that patient comes for a follow-up, it's the same way of measurement, and you could actually follow up carefully. But it's not just a measurement. How about segmenting our images? These beautiful images, I remember segmenting images 10 years ago. A couple of these images would take me a couple of days, simply doing nothing but this. Now, you just open your case and you have these segmentations laid out for you right away. Bone fractures is another low-hanging fruit when it comes to the world of AI, where you would have emergency departments benefiting from applications such as these, being able to show you fractures for every patient that comes to the emergency department with a trauma, or every traumatized patients. And you know how chaotic it can be in an emergency department. So this is scaphoid fracture. This is another fracture. And we were wondering whether this is a sigmoid bone. The application actually highlighted it as a fracture. CT was done, confirmed to be an avulsion fracture. I believe most of us radiologists, I definitely missed this one. Spine MRI interpretation. Spine MRI, I think it's the most requested procedure for an MRI, and if you could have an application that would lay out the findings, this would be amazing. They might be straightforward, they might not be so straightforward, but if you have something to lay it out for you, that would be really amazing. Now, something that's really close to my heart is AI in cardiac imaging. Maybe because I'm not so good in cardiac imaging, so any help was welcome for me. Now, to have a system that would segment the coronaries and give you the anatomy with the stenosis automatically, but not only the anatomy, histology, plaque composition, and we know how important plaque are in the world of cardiac imaging. And now, the star of the show is FFR, fractional flow reserve, which was till recently only done through wire FFR, or using special casters with a special technique. Now FFR is obtained automatically from CT images. Not only that, simulation of stents to be placed is available. Now, coming to number 8, screening, and of course I need to say no more about the value of AI in the world of mammography screening. In fact, now it's accepted practice in Europe for AI to replace one of the two readers. Two reading or double reading for mammography is the standard. Now it's accepted that one of the readers is AI. And in some place in Sweden, both readers are AI. Anyway, we have images like this showing the abnormality, lung cancer detection, AI, with auto-reporting, prostate cancer detection with auto-reporting again from MR, and osteoporosis screening, which is an form of screening that was not possible before that, only through DEXA, and coronary artery calcification for screening. So these are 5 screenings. So this is not just 1 point, these are actually 5. Now reporting, and my colleague Ahmed, I'm sure will be presenting this in his next presentation, I hope, and where we are able, through AI, to actually bring the most important and the most critical patients to the top of our reporting list. But not only that, we're able to get that report through AI, so we get the body of the report, and then the impression is extracted automatically. But not only that, the follow-up recommendations, and then the follow-up on the follow-up. Everything is done automatically through AI. And everything is actually sent to you on your mobile. Dental imaging, most of us turn a blind eye to dental imaging, but the role AI is playing in dental imaging is amazing. And now every dentist with one of these tools next to him is definitely way more comfortable dealing with his patients' ability to segment such images. Now, this is really my closing slide, bar 1. So AI has really profoundly impacted our imaging, and it enhanced our diagnostic accuracy, speeding image analysis, and providing deeper insights into patients' health. These are some of the benefits. Basically, it will enhance every step in our workflow, with increased productivity being the net result. I will leave you with Peter. So the question was, when will it be malpractice not to have AI? Now we're wondering whether, should we use AI? Is it legal? What are the regulations? The question should be this: when will it be malpractice? Not anyone in that forum said more than 5 years. Everyone said it's going to be malpractice not to use AI in less than 5 years. With that, I thank you, and thank you for the extra minute.